Good afternoon to one and all. Welcome to today's session on what is IVF conception. To speak on the topic today, we would like to welcome Dr. Divya Bigai, our in-house consultant for obstetrics and gynecology. She has done her MBBS, DNB in obstetrics and gynecology, fellowship in minimal access surgery, and a fertility training at Crest from Singapore. We welcome you, Doctor. You can now take over the session.
Thank you. Good afternoon, all. So, today my topic is IVF conception. What is IVF conception? So, coming to the topic title IVF. So, what is IVF? Basically, IVF is in vitro fertilization. So, in vitro meaning outside the human body. So, here the fertilization happens outside the human body. So, what happens naturally is that, like, the fusion of the sperm and the egg happens in the fallopian tube. So after the fertilization, that is the fertilized egg, travels into the uterus, gets implanted there, and a pregnancy is formed. This is how a natural pregnancy is formed. So in IVF, here we take all the mature eggs. We collect all the mature eggs from the ovaries, and these mature eggs are fused or fertilized by the sperm in the lab under the microscope. So after this egg and sperm fusion is done, the embryo is formed. The fertilized egg is called embryo. So once the embryo is formed, the embryo culture happens. Like we allow the embryo to grow in the lab for 3 to 5 days. After the embryo culture, the embryos thus formed are transferred back into the uterus. That is, this procedure is called embryo transfer. So the formed embryos are transferred back into the uterus, and these transferred embryos should have to get implant in the uterine cavity. That is the sticking of the embryo to the uterine lining, and then thereafter it should grow inside the uterus. That is how a IVF conception or IVF pregnancy is formed. So the entire process of collecting the eggs, fertilization with the sperm in the lab, and embryo culture. After the embryo culture, the transfer of embryo into the uterine cavity. And after 2 weeks from the embryo transfer, a pregnancy test will be performed. And once the pregnancy is confirmed, there ends this. The IVF conception is formed. So this is what we call it as IVF conception. IVF is nothing but an assisted reproductive technique. So here, where do we use this IVF? IVF is a treatment option for infertility. Not only for infertility, but also we are using IVF as a treatment option for couples who are suffering with genetic problems. So these are the two main areas where we use IVF: infertility and couple with genetic problems. So coming to infertility, again IVF is not the only option of treatment for infertile couple. So we have, before attempting an IVF, we have less invasive options of fertility treatments, starting with ovulation induction. Ovulation induction is nothing but a process where egg growth medications, the tablet form or injections, are administered to the woman to promote egg growth. Once at the time of as the egg grows, we'll be monitoring the egg growth through follicular study. It's nothing but a transvaginal internal ultrasound scan where the follicular size, the growth in the follicle is monitored, and then once the follicle reaches the dominant follicle size, a trigger is placed. Like for the maturation of the follicle, an injection is given, and the couple is advised to be in contact around the time of ovulation. That is called timed intercourse. So ovulation induction and timed intercourse. This is a basic fertility treatment. And the next step is like IUI. So IUI is a intrauterine insemination. So this is a process where the sperm is transferred into the uterine cavity. So here IUI is like, sometimes IUI is performed for a male factor. Suppose there is some mild male factor infertility where the semen parameters are slightly abnormal, like a low sperm count, low motility, or any problem in the morphology of the sperms, where there are subnormal semen parameters. IUI is advised, or sometimes patients with unexplained infertility. This is a condition where the couple is like the couple, the male and female partner, or like investigation wise, they are absolutely fine. There are no known identifiable cause for the infertility. So everything looks fine, but still they are not able to conceive. That is like unexplained infertility. This is a scenario where we will be recommending IUI. So IUI is nothing but intrauterine insemination or artificial insemination in simple terms. So IUI, after trying IUI, if suppose the couple is not able to conceive, maximum we suggest 6 cycles of IUI. So if within 6 cycles of IUI, a couple is not able to conceive, then for like failed IUI, in case of failed IUI, so that those are the couples will be advising for IVF treatment. This is like these are the fertility treatment options other than IVF, like fertility, ovulation induction, and timed intercourse, intrauterine insemination. These are the fertility treatment options other than IVF. So coming to IVF is like can be a primary treatment for a couple who is not able to conceive due to the following reasons, such as bilateral tubal blocks, or a woman who had undergone tubal surgeries where the tubes are removed. So these are the two conditions where the fallopian tube is not functioning or it's absent. So, as I already discussed, for a natural pregnancy to happen, we need the fallopian tube because it is the area where the egg and the sperm meet and the fertilization happens. So, in a natural pregnancy, for a natural pregnancy to happen, or for example, for IUI, intrauterine insemination also, we need the fallopian tubes to be present and open, patent fallopian tubes. So, we generally do the dye test or a tubal patency test to check for the to check whether the fallopian tubes are open or not. So only if the fallopian tubes are open, the women can conceive through natural method, that is natural conception, or through intrauterine insemination as well. But if the tubes are blocked, both sides tubes are blocked, or the woman has lost tube due to previous tubal surgery, for example, ectopic pregnancies where the tubes are removed, in those cases, IVF is the primary treatment. So they have to undergo direct IVF because the tubes are blocked. So IVF is the primary treatment for women with bilateral tubal block. Now another condition for this is for women. For male, if it is a very severe male factor, it's a mild male factor, we can try with intrauterine insemination. But if it is a severe male factor infertility, like below average sperm concentration, like the sperm count is extremely low or the motility is extremely low, or sometimes they may not be able to give semen sample, wherein which like we have to retrieve the sperms from the testis directly, sperm retrieval techniques. That is a procedure where we aspirate the sperms directly from the testis or the epididymis. We have various procedures called TSA, testicular sperm aspiration, or TC, that is testicular sperm extraction. So these are the various sperm retrieval techniques. So if we are going to retrieve the sperms, these sperms can be used for fertilization only through IVF because these sperms cannot be used for any other method. So these are the indications, these are the conditions where the couple has to undergo, where the couple has to opt for IVF as a primary treatment. So coming to the next indication for IVF, that is one, I said two. One is IVF for infertility, the other thing is IVF for genetic disorder. So in this scenario, IVF being a procedure, a treatment option for genetic disorder, here if suppose a woman or her partner is at risk of transferring a genetic disorder to their child, they are the candidates for pre-implantation genetic testing, which is a procedure involving IVF. So in this couple, they are not like infertile couple. They are able to conceive naturally. But here, why we are suggesting IVF is to perform the pre-implantation genetic testing. So what is pre-implantation genetic testing? This is a testing in which the embryo, a cell from the embryo is biopsied, and after the biopsy, it is analyzed for the chromosomal makeup, as well as it will be screened for a genetic disorder, which we already know. Like if a couple is already known to have some known genetic disorder, then we can particularly screen the embryos for that genetic disorder, whether the embryo is being affected with the genetic disorder or not. This is only is called as a pre-implantation genetic testing. So for that, we need the embryo in hand. So through natural pregnancy or through IUI pregnancy, we can't do these tests. So for the couple to have a healthy baby without any genetic disorder, so they have to undergo IVF procedure to undergo this pre-implantation genetic testing. And another indication for IVF is the fertility preservation for cancer patients. So in cancer patients, we all know the cancer treatment involves chemotherapy and radiotherapy. These are the two treatments where the fertility will be affected. So once a individual is being diagnosed with cancer, before they undergo these treatments like chemotherapy or a radiotherapy, they can make use of this assisted reproductive techniques to preserve their fertility before undergoing these treatments. Like for an unmarried girl who's been diagnosed with cancer, she can undergo this oocyte freezing, where her eggs are collected and freezed and kept for future use. In a married woman, we can do embryo freezing. Since a married woman husband is there, so we'll retrieve the eggs from the woman and we'll use her husband's sperm to form the embryos and we'll freeze the embryos. And for the male patients who have been diagnosed with cancer, we do the semen freezing. So these are the fertility preservation option. This is like which is like a boon to the cancer patient, because after cancer treatment, their fertility is going to drop. So through this method, we can preserve their fertility, and once the oocytes or embryos or the semen, everything is freezed and kept, and in future when they want to plan their family, they can make use of IVF to get pregnant. So this is one very like the recent involvement of IVF for the fertility preservation in cancer patients. So coming to the steps in IVF. So what do we do in IVF? So IVF is like once the couple comes to us, we'll take a thorough history and we'll evaluate both the partners, the blood test, and then the scans, and the male, the semen parameters and everything, and we'll check for the tubal patency and everything. Like after completely evaluating the couple, if we are deciding for an IVF treatment, so once IVF treatment is decided, the woman will be taken up for the controlled ovarian stimulation treatment first. So that is nothing but giving daily injections starting from day 2 of her periods for the egg growth, to promote egg growth, and the egg growth will be monitored through serial follicular studies, nothing but the internal transvaginal scans. Once the egg grows to the good number of eggs comes to the appropriate size, and an injection will be given for maturation, and the oocytes will be collected. Oocytes, nothing but the eggs. The mature eggs are collected through transvaginal ultrasound guided and needle aspiration, which is a procedure done under anesthesia. So basically, it is a daycare procedure. So once the eggs are collected from the ovaries, the same day the husband's sample will be processed, and uh, the sperm and egg are fused under microscope. So IVF is in vitro fertilization. One of the advanced technique is the ICSI or ICSI. This is called intracytoplasmic sperm injection. It's an advanced technique where we directly inject, one single sperm will be directly injected inside the mature egg, thereby ensuring fertilization. So once the egg and sperm fuses, zygote is formed. So there, and it is allowed to grow in the lab for 3 to 5 days. So once the embryos are formed, so the embryos are transferred inside the woman's uterus. The embryo transfer, coming to embryo transfer, we have like fresh embryo transfer and frozen embryo transfer. In fresh embryo transfer, the embryos thus formed like after the egg pickup, 3 to 5 days of embryo culture, and then the embryos are transferred immediately, the same cycle. The embryos are kept inside the uterus. In frozen embryo transfer, after the embryos are formed, the embryos are freezed, and that cycle the woman will get her periods. The next cycle, she'll be given some medications to get the good uterine lining, that the endometrial lining, and then the embryos are transferred in the next month. That is called frozen embryo transfer. After the embryos are transferred, we give them the luteal phase support. Luteal phase support is nothing but to supplement the progesterone hormones in the form of tablets, pessaries, injections. We usually give this luteal phase support in the IVF conception for a period of 10 to 12 weeks of pregnancy. So, these are the various steps in IVF pregnancies. So, coming to I would like to discuss some common myths about IVF conception. So, I can see some questions coming up here as well. Anyways, I'll first discuss what are the common myths I have noted it down, and any other questions also I'm ready to answer. So, first thing is one thing that's there in the common public's mind is like IVF is the only option only option to conceive for the couple who are not able to conceive naturally. So as I already discussed, IVF is not the only option for infertile couple. We have other options like ovulation induction, intrauterine insemination. Like we can try all those options. If it is not successful, then we can go for IVF. Of course, as I already told you, IVF is a primary treatment for women who have got bilateral, both side tubal block or a severe male factor. Apart from these two conditions, all other couple can try the other less invasive methods like ovulation induction, timed intercourse, ovulation induction, and intrauterine insemination. So IVF is not the only option for infertile couple. The next thing is like, do I need to take bed rest throughout my IVF conception? This is another common thing that is there in public's mind. Like IVF itself, they think it's something like very something very exclusive thing, and it's like very some out of normal. They have to be in bed rest. They should not be throughout the pregnancy. They have to be lying down, and they have to be taking injections, lots of injections throughout the pregnancy, which is not true actually. See, IVF pregnancy, as I already discussed, in vitro fertilization. The fertilization happens outside, and the embryo once transferred inside the uterus, and the embryo gets implanted, and the pregnancy is formed. Once the pregnancy is formed, this is will be considered like a natural pregnancy only. The only difference between an IVF pregnancy or IVF conception and a natural conception is that we give this luteal phase support. That is the progesterone hormones till first 10 to 12 weeks of pregnancy. That is the only difference between a IVF conception and a natural conception. Apart from that, the regular antenatal checkups, that is your pregnancy checkups, monthly visits, the scans, everything will be same like your natural pregnancy. In fact, like for normal delivery also, there is no contraindication for normal delivery in IVF conception. An IVF pregnant woman can as well undergo a normal delivery. So there is no such thing like complete bed rest throughout pregnancy or daily injections just because an IVF is done. Daily injections for some other reasons, like for recurrent pregnancy loss, where we give this heparin injections daily, that is not indicated. Even in a natural pregnancy, we are going to give heparin daily, not only like for IVF conception. So that IVF per se doesn't require complete bed rest throughout pregnancy. So IVF pregnant women can continue to work, and they can as well have a normal delivery. So that is about the second one. And the third one is like, will my baby born through IVF conception be a normal child? That is another thing. So the same answer. It's like your genetic material, your couples, the male wife's egg and the husband's sperm, and the pregnancy is formed like outside the human body, but the baby is yours. Like we transfer the baby inside the uterus, and it will be normal only. So millions of babies are born through IVF. So they are normal, just like any other baby born through a natural conception. So the risk of birth defects or the miscarriage or like more like of natural conception. So it is not like a baby is born through IVF or abnormal or anything. They are very much normal, like a baby born through a natural conception. So we have like lots of records. Like, as I told you, millions of babies are already born through IVF. They don't. So none of the studies have reported like there is a problem with the IVF babies. So you do not be worried about that. And IVF pregnancies are always multiple pregnancies. So this is another thing, no? The couple, whenever they are after we counsel them for IVF, the first question arises like, doctor, how can I manage a twin pregnancy? Multiple pregnancies, nothing but twins commonly. So twin pregnancies, how can I manage twins, and what are the other? And they are scared about the complication associated with twin pregnancies, like preterm deliveries and managing two babies as well. So this is not always true. Like not all IVF pregnancies are twins or a multiple gestation pregnancy, multiple gestations. Because we have the selective single embryo transfer nowadays, which is a procedure which has good success rate for a singleton pregnancy in selected cases. So coming to the embryo transfer, now we have like recent guidelines, like we can't transfer more than like three embryos at a time. So we usually transfer two, only maximum two at a time, and in selected cases, we are transferring only one. That is called the single embryo transfer, wherein you get a singleton pregnancy. So there is no chance for multiple pregnancy when a single embryo is transferred. So we are nowadays we have that option as well. So need not be like IVF pregnancies are not always twins. And another thing is like IVF increases the risk for developing cancer. So this is again like, as I already told you, like millions of babies are born, and like millions of couples also have undergone the IVF treatment so long. So there is no scientific evidence that IVF, or for that matter any other fertility treatment, increases the risk of developing cancer. So these are the common myths which I wanted to discuss here, and yeah, now I can like I'll answer some of the questions here. So here I can see there is a question: are there risks to having a baby through IVF? That's what I just now discussed. There is no extra additional risk for a baby born through IVF. IVF babies are just like normal babies born through normal pregnancy. Is the egg retrieval procedure painful? Yeah, it is a painful procedure because we are going to use a needle to aspirate the follicular fluid. So that's why I said it is done under anesthesia. So we'll be giving anesthesia to make you pain free, and then only the egg retrieval or the egg collection is done. So, do fertility hormones pose long-term health risks? Actually, these fertility hormones, like it's used for a only at the time of the treatment. So, it doesn't that's what I already discussed. There is no scientific evidence that it has a long-term health risk. So, how long of a wait is recommended between a failed IVF cycle and trying again? So, failed IVF cycle is like if embryo transfer is done and 2 weeks later the pregnancy test comes out to be negative, then it's like it's a failed IVF cycle. If you have got embryos, like generally there will be some embryos freezed and kept, right? So, if there are, say, for example, you have some six embryos stored, and first time maximum, as I told you, maximum we transfer two at a time. So after the transfer of two embryos, the pregnancy test comes out to be negative. Then you'll get your periods. After that, there is no recommended time limit or anything. But generally, we advise at least a month gap for us to evaluate why was this failure happened, and the same hormonal checks and all will be revisited and seen and everything. And then with after 1 month time, you can undergo the next embryo transfer. If your embryos are already stored, you need not undergo again the stimulation. You can directly go for the frozen embryo transfer, maybe after a month's gap. Or if you want to undergo stimulation also, at least a month's gap is required, like to recover from the thing, and then to start on to the next step. So, what are the options if a woman's own eggs are not producing a pregnancy? See, in this question, I want to make it clear. If women's own eggs are not producing the pregnancy, could be because of the less number of eggs in the ovaries. That is, we call it as like poor ovarian reserve. Normally, we do this blood test called anti-Mullerian hormone to check for the ovarian reserve, and we check for the ovarian reserve through scan as well. That is called antral follicular count. So through these methods, we'll know how good the reserve is for that woman. Nowadays we are seeing lots of women having poor ovarian reserve. Actually, this eggs, the ovarian reserve, as age advances, the ovarian reserve declines, it falls. So nowadays we are seeing some younger age group women with very less reserve. Say for example, woman's age is 30 years, but when we look at her reserve, it's looking like a woman was like at a 50 years. What would be the reserve? We see such low reserves in a 30-year-old woman. So when the reserve is very low or poor ovarian reserve, we call it as poor ovarian reserve, where the AMH is extremely low, in those cases there are like only less eggs in the ovaries, and the quality may not be also be very good. So for such women, we can try these fertility treatments. Like what are the all the options can be tried. In spite of trying all these options, the success rate will be very much low in these women with poor ovarian reserve. So in case of failure, like women who have tried IVF also, but that also failed, the next option for a woman with poor ovarian reserve with repeated failures, fertility treatment failures, including IVF, we give the option of donor eggs. Here, donor eggs is like we collect eggs from a younger age group women with a good ovarian reserve, and then that can be used for the IVF treatment. And these women can conceive. Women with poor ovarian reserve with failed fertility treatment, including IVF, can get pregnant through donor egg programs. So this is one area where like we have to be like couples who are postponing their pregnancy or late marriages. Nowadays we see lots of couple getting married at a later age. Like say for example, they are getting married at like 34, 35 years, like that. So for women, the good fertility period is like 32 years, I would say. Once they reach 35, 32 to 35 is like borderline. Less than 32 is perfect time for conception, and more than 32 to 35 is little bit borderline. And once they touch 35, women touching 35, the fertility drops drastically. So in this platform, I would like to emphasize on this, like women better to plan their first child at least before 32 or at least before 35. And women who are known to like who are already know like they are going to postpone their pregnancy, or they are going to get married later only because of some family and or career issues, better they have to get themselves checked for the fertility, like through these tests. And if they find out to be like their AMH is on the lower side, they have other options now, like oocyte freezing. So though they are not married, they can do the oocyte freezing, and after that, even if they get married at 35 and 36, their eggs freeze at a younger age has good potential to form babies. So after they get married, they can make use of these eggs through IVF treatment. They can get conceived. So this is a way like for a woman in this era of like ambitious women who are getting married late, or like what even if they get married also they are postponing pregnancies. So this can be kept in mind. So I would suggest all the couple to undergo a counseling before they decide on postponing their pregnancy. Okay. So uh, so we have come to the end of the session. So I've detailed about like IVF conception and what do we do, and what are the myths and other things. And so that's what like this I would like to give this as my take home message from my talk. Like a woman should be aware of her fertility, and we have various tests to know that, and especially women who are planning to postpone their pregnancies, better to undergo fertility counseling with a fertility specialist to know if it is safe to postpone their pregnancy, or to discuss with the doctor what are the other options available, and make use of the recent advanced technique to plan their family. Yeah. Thank you.